This is the Paragard intrauterine copper contraceptive. This device is used by women to prevent pregnancy. However, it does not offer any protection against sexually transmitted infection. This is what the device looks like. Here's some statistics on Paragard. Its typical failure rate is 0.8%. Perfect use failure rate is 0.6%. Which means under perfect use, Paragard is going to be 99.4% effective, as opposed to using no method, where there is a typical and perfect failure rate of 85%. Some advantages and disadvantages to Paragard. Advantages: it's highly effective and safe, it's long-acting, no interruption of intimacy, and no hormone level change because Paragard contains no hormones. Disadvantages is that it may pose a slight increase in risk of pelvic inflammatory disease, or PID. It may cause menstrual problems. There may be more risk for women who have never had children, and it does require a trained medical professional for insertion and withdrawal. One thing that should be kept in mind when choosing Paragard is that patients need to do a monthly self-check. Here on Paragard's website, they give directions on how to do the monthly self-check. And right here it states that you reach up to the top of your vagina and feel for the two threads, but don't pull on them. Call your doctor immediately if you cannot feel the threads, if they seem much longer, or if you feel more of Paragard than just the threads. If your Paragard is in the wrong position, it won't work properly and you won't be fully protected against pregnancy. In this case, you should be sure to use a backup method of birth control until you see your doctor. I think important considerations to make are going to be, for one, an advantage is that it's highly effective and long-acting. Paragard can be left in place for up to 10 years, and I think this is a good option if having a family is something that you either don't want to do or it's something that is going to be further down the road. However, it can be removed far sooner than that if you do wish to start a family. I think an important disadvantage to consider is the menstrual problems it might cause. Here on Paragard's website, they do go over the risk of bleeding changes that may occur with Paragard. Your period may be heavy or longer, and some women may have spotting between periods. I think that if you're already having some issues with heavy bleeding, or if pelvic inflammatory disease is an issue for you, then these are things that you should be discussing with your physician before choosing Paragard.